stomach started to hurt pretty bad, and it felt like my legs were kind of really weak, and I was pretty tired.
She started having blue lips and her extremities were cold. So that's when it was like, this is not a normal flu.
Sean Daly is Juliet's dad.
Did you think that this might be a COVID or a coronavirus?
My wife thought it was a possibility. She called to try to see if she could get tested. She didn't meet the criteria. She was more or less a healthy 12-year-old.
By that evening, Juliet was nearly dead.
They had me leave the room to intubate her, so they put her under an anesthesia, and then she went into cardiac arrest for a little less than 2 minutes, and they had to perform CPR.
What was her condition when you first saw Juliet?
She was about as close to death as you can get.
Dr. Jake Kleinmahan is a pediatric cardiologist at Ochsner Hospital for Children in New Orleans.
Her heart was barely squeezing. She was going into kidney failure, liver failure, intubated emergently, and put on a ventilator.
It's hard to believe we are talking about this same beautiful little girl. But it's also hard to believe that all of this was possibly related to COVID-19, a disease that wasn't really supposed to severely affect kids. Now, it even has a name. It's called multisystem inflammatory syndrome in children.
There's a lot of cells and cell signaling in the body that is just going crazy. And what that's doing is it's creating a lot of inflammation that's affecting the heart, the liver, the kidney, and really all the cells of the body.
It's been described as a Kawasaki-like disease. That's another inflammatory disease most commonly diagnosed in children. Awful rashes, a strawberry-appearing tongue, and destructive inflammation. But this is also different. There are so many questions, like why now? Why months into this pandemic are we first seeing this? And why is it so devastating to children in the United States and Europe, but not so much in Asia, where some of the first children were infected?
We have interesting information coming in from Japan, as well as Korea and Taiwan, that no one there that we have been in contact with has seen this severe form of cardiovascular collapse in children.
Dr. Jane Burns is director of the Kawasaki Disease Clinic at Rady Children's Hospital, San Diego.
No one can tell you for sure that the SARS-CoV-2 virus is a trigger for Kawasaki disease, but there certainly is circumstantial evidence.
We're seeing this in kids who don't have an active COVID infection. Some of them do, but a lot of them are testing positive for antibodies.
A study published in The Lancet on Wednesday found that the number of children diagnosed with a Kawasaki-like disease in Bergamo, Italy, jumped 30-fold after the pandemic overtook the region. Still, in the United States, as frightening as it is, for now, it still appears rare. Juliet was discharged after 10 days in the hospital.
How are you feeling now? You look great.
Well, I am feeling good, and there doesn't seem to be any long-term effects.
Are you back 100%, would you say? Back to normal?
I still feel a bit out of place. I feel kind of like 99%.
We'll take 99%.